Hello, everyone. Welcome to another review for our practitioners, both in Paai and Lam. Okay, for today, we shall be analyzing or studying the shiny and mirror tongues. Okay, actually, there are two separate descriptions, no? But you would usually see them together. So these tongues, they have no coating. Okay, so it's very Yin deficiency. The entire tongue body appears smooth as if the skin has been peeled off. And this gives the impression of a sheen, but in reality, the tongue is dry because this time the coating is gone. The mirror tongue is sometimes called shiny tongue. There is a difference between the two. Okay, a shiny tongue is always red or dark red. So remember that, shiny tongue. So don't be proud of your shiny tongue. It's always dark red or red. It indicates severe kidney yin deficiency. And the tongue body will show cracks and dryness and may even be contracted. And if the tongue is red, the shiny tongue will mean that there is actually, this follows. When you have kidney insufficiency, there will always be stomach insufficiency, and there is dehydration. So there's severe lack of body fluids. So if you happen to see someone with a shiny tongue, think of dehydration. So if there is deficiency of fluids, the stomach becomes dry, so you do not form the coating at all. Okay. If the center of the tongue is visibly shiny, so you saw the tongue of your patient, and what catches your attention would be the very, very shiny center. So that represents the stomach. So there is no coating. We call it stomach yin deficiency. If the entire tongue is shiny, so entire tongue, it's more encompassing. That's the kidney yin deficiency. So if it's only the center of the tongue that's shiny, that's stomach yin deficiency. If it's the entire tongue, kidney yin deficiency. And this could mean that your patient is in the terminal stages of cancer, might have liver cirrhosis, and we all know for a fact that um, during the liver cirrhosis stage, there's no turning back, no? Kaya if I were you, you have to make sure when you are still in the fatty liver stage, you have to make your treatment very effective, or maybe you have to advise your patient on changing the lifestyle or even the diet. So we have some, I'm sure all of you here are very good at recommending liver-friendly food. Okay. Or the patient may have TB. So butin na lang pag may TB because we can easily treat TB these days. So again, if the tongue is shiny, there is severe deficiency of fluids and yin. So there is dehydration. Okay. It's a little bit ironic, diba? If it's shiny, so it has a lot of sheen. It actually means that there is dehydration. There is severe fluid and yin deficiency. If the shiny tongue develops during illness, so this is a sign, this is a red flag. You have to prepare for the worst. So let's ask Dr. She from Palawan. Have you encountered patients like this? Malapit na.
Which one?
Yung shiny tongue.
Yeah,
Okay.
meron.
Is she still alive?
Um,
Okay.
sort of.
Okay. But she doesn't look like as if she will say goodbye anytime soon.
Not so pa naman.
Okay. So that was the shiny tongue. It's more terminal, it's more severe. Let's go now to mirror tongue. So that means you can actually probably see your reflection. So this is called the mirror tongue because the prickles or the tongue papillae, they completely disappear. So that's why it looks like a mirror. And the papillae on the tongue will actually depend on your Chang Chi, your true Chi, and the fluids and the yin of internal. So, of course, if you are malnourished, you do not expect to have a very good immune system. So, again, if you are so deficient in nutrition, that's why we are very, we envy the experts on nutrition like Dr. She, and I'm sure there are others here who Yung naturopathy, di ba? So you would know what to recommend to your patients. So if the fluids in yin would dry up, the qi diminishes and the tongue papillae will not be properly nourished. So what happens is the papillae will shrink, they become smaller and smaller until they disappear altogether. And then your face will look like a mirror. So again, this is due to deficiency of fluids, yin and qi. Okay, mirror tongue represents a combined pattern of both qi deficiency and yin deficiency. So this is not as bad as the shiny tongue. Okay. The tongue body color and the coating, if you still see the coating, will show which pathology predominates. So again, if you have a mirror tongue on a pale tongue body, so pale, no? So there is very, very severe, very deficient blood because of long-standing spleen and stomach qi deficiency. And by the way, if you have patients with yin deficiency or even qi deficiency, it is not enough that we only do acupuncture. You have to also recommend foods to eat, no? Or herbs if you are good at herbology. The stomach qi is too weak to build a new coating. And blood deficiency is so severe that the tongue is not moistened anymore. Okay? So if you have a mirror tongue and the tongue is pale red, I think this is a normal color, but it's dry. So this is qi and yin deficiency plus heat. If the mirror tongue is red and painful or tender, there is yin deficiency with blazing fire. Mirror tongue on dark and purple tongue body, there will be stagnation, no? Blood and qi stagnation. Let's go to some cases. So here we have the tongue of a 72-year-old female, okay? Came in with these symptoms. Shortness of breath. Why kaya? Why do you think so, Doc She? Can you look at the lung area? It's a little bit swollen, diba? Actually, the
Yes.
tongue is swollen. There's severe exhaustion because although we cannot really see the posterior third so much, I was looking at the possibility of essence deficiency. But I guess there is a reason why this patient is so severely exhausted. Oh, the most significant here is the weight loss. Okay? So, congratulations, Doc She. You lost a lot of weight within 3 months, within 2 months. Uh,
Dito ka for 6 months na.
Sige, that means you're healthy. Kasi
Yeah.
if that was cancer, you would lose a lot of weight in just a month or even less, no? You will drastically lose weight. So that means you're healthy, of course.
That's not normal eh.
It's not normal. Yeah. So kaya you have to be patient. It took you like 4 months. Wow, amazing.
I started February this year eh.
Ah,
So gradual lang din talaga ginagawa ko kasi I'm not planning
you're
on
not very consistent.
yeah, I'm not planning on losing too much talaga kasi with my age and with my ano din,
Oh,
body build, parang pangit din sobrang payat din.
oo naman. And people might be shocked, no? Or
Oo.
even they wouldn't like you, the idea of seeing you as, di ba you were slim before?
Ako naman, well, genetically talaga, payat talaga ako.
Ah,
Siyempre, naging mother ako. So, at saka naging yun yung kain. So,
and the
yun.
stress.
Yes, the stress, ang kulang sa tulog, and
Yes.
yun.
Okay, this one, aside from weight loss, may lack of appetite. Oh, Western diagnosis, breast cancer. Of course, we cannot diagnose using using only the tongue and the pulse. Can you see this? Wala, you don't see anything talaga. So you have to rely talaga on ano.
Pero
Okay.
yung ano, Doc, yung sa posterior third niya, Doc, may mga whitish, ano siya, yung
Yes,
whitish.
yes, a lower warmer.
So, will that be LI or SI po?
Most likely, it's going to be kasi wala man siyang urinary
Oo,
symptom.
problem.
So it would probably be LI or even kidney. Yeah. Kidney most likely. Bladder. Yeah. Okay, so pale red mirror tongue. Oh, this is mirror. Can you see the reflection? Sige, I'm sure everyone would look at his tongue later. Okay. Pale red. Pale red is normal, no? So again, di ba, we mentioned if it's mirror tongue, okay, we have some issues. The sides are slightly red and swollen, no? Okay, it's very, very spleen, no? Kasi di ba lumalapad siya, it's so mataba. Ah, okay, this one is very textbook-like, tofu-like. I think this is what you were trying to say, Doc She, no? Tofu-like, tofu. Who likes tofu? Thin coating on the
Yeah,
left
yeah.
side, more on the left side, no? Okay, let's do
Yeah.
the diagnosis. So this is severe spleen and stomach chi deficiency. Yeah, because obviously the tongue is so wide, so swollen, and deficiency of fluids. Okay, di ba? If you can see the reflection already, that means there is dehydration. So there's deficiency of fluids. And since the sides are slightly red and swollen, so there is heat in the liver. Okay? Hindi pa fire, it's still heat. It's slightly red pa. And, okay. This is something that we should all remember. I encountered this before, but every time I see the tofu like, I cannot. uh, yes, I remember I saw someone with this kind of tongue, tofu like. So there is dangerous yin depletion or yin exhaustion. Naubos na yung yin. Why? Because of the cancer, probably all the nutrition was being used up already by the cancer cells. Okay, now let's go to assessment. Doc She, would you like to participate? Did you do your
Sige
assignment?
daw.
Sige. Or and also mom tricks, no? What three organs have the most intimate
Yes,
Zangzi relationship with the tongue? This is very important. Most intimate. This is probably the reason why we always look at the tongue.
the
Yeah.
heart, spleen, stomach.
Yes. Wow. Yes. Heart, spleen, stomach.
Mm.
Just like kanina, di ba? The diagnosis was severe spleen, stomach, um, chi deficiency. And since you don't see the coating anymore, so that means there is dehydration or deficiency of fluids, the heart. How is the coat formed on the tongue? Why do we always look at the coat? Doc She, would you like to?
The stomach. I'm sorry.
Sige, sige.
Doc She.
Sorry about
Sige,
that.
Doc. Sige, it's okay. Si Doc She. Bahala siya.
Would you like to do you remember how is the coat formed?
I guess it's the severity of the ano to, the deficiency.
No, no, no. This one is supposed to be normal. You're supposed to form the coat. Di ba normal is thin white coating. So the question is,
Yes.
yeah, kasi there's such thing as no coating and there's also such thing as very thick coating. So the question here is, what forms the coating of the tongue? What causes the tongue coat to form? Okay, Mom Tricks.
Mm. The stomach cheese rising and evaporation.
Okay, it's actually, yeah, the residues, no? So it's the remnants of the stomach chi. That is why we always look at the coat, diba? So if the coating is gone, that means the stomach chi, the stomach yin is gone. The rising and evaporation of the stomach chi. The active movement of the tongue with voice and speech relates to what organ? You see, the tongue should also move aside from having a voice.
The heart.
Yes, because the heart governs the mind. Okay? Heart. Um, I'm sure you've seen people na may heart attack, diba? So the tongue is stiff and sometimes it's like deviated lang. Quality of the tongue that is coarse, hard, and sturdy, that's COA ha. The color is
Mm.
dark and represents an excess pattern. So what type of tongue can we see here? Will it be a soft tongue? Will it be a flaccid tongue or a tough tongue or a stiff tongue?
Uh, Tough tongue.
Yes, or stiff tongue. The quality of tongue that is same as tough, but more coarse on the surface. So again, this is another tip, no? If you see that the surface is a bit rough, ay sinabi ko na pala. It's excess. So what description of the tongue are we talking about here?
Rough.
Rough. Sabi ko. Kasi it's my like,
Tongue.
if it's only the coating that is slippery, um, it's dampness, no?
Mm.
So dampness can lead to phlegm. Phlegm is like rough siya talaga. So excess. Okay. Quality of tongue that is delicate, weak, slightly swollen, smooth, light color, and this represents deficiency pattern. So
Tender.
fragile, yeah, tender. Hindi siya matapang. Quality of tongue that is unable to move, extend or retract easily. Ay nako, yung kanina pala, tough lang siya, matibay. This one is unable to move. There's a difference between tough and stiff. My bad. I was wrong there. Yeah, sorry about that, Mom Tricks.
Okay.
If it's a tough tongue, it can still move. But this one, if it's this type of tongue, it cannot move at all. This represents pericardium heat or wind phlegm.
Stiff.
Yes, stiff tongue. So wind phlegm. Just
Winfred.
yeah. What does a thin body indicate? Chronic or acute condition?
Chronic.
Chronic. Thin and pale tongue body. What is
Blood deficiency.
yeah, thin and pale. So if it's yin
Mm.
deficiency, it's no coating, diba? Mm,
No cold.
pale, yeah. Or it could be red if there's empty heat. And the last one, thin and red without coating,
Yin deficiency.
yin deficiency. Thank you so much. Please join us again next time.
Thanks, Doc.
Thank you.